So as a rheumatologist, I've talked about how, we can look at blood work, especially a CBC or kind of your basic blood counts, to get an idea if there's some features that shows this person has inflammation in the body. So I made a video about that with like elevated white blood cell count or platelets. We also look at the CMP or comprehensive metabolic panel. Now that's like the basic like kidney, liver, electrolyte type panel. That one's a little bit harder to see changes that can indicate like inflammation, but there are things you can look at. And as a rheumatologist, if I'm scanning, someone brings labs into me or I do them, what am I looking for there? First, I always tell my patients I have to make sure your like major organs are good. So it's like kidney function and liver function for a few reasons. One, autoimmune disease can affect those organs, so I'm trying to see, are they elevated or off because the disease is affecting it? For example, lupus is having kidney failure associated with it. And then the other is I use medications and they're filtered through liver and kidneys. So I have to appropriately pick and dose medications. So I need to know what the function is for those. If I'm really trying to like get a sense of like kind of like inflammation, I may look at like the total protein albumin. That can also be abnormal if the person has some chronic inflammatory state, and it's not just autoimmune disease. Other chronic conditions like malnutrition can also affect those.